Herzlich willkommen zu einer neuen Folge auf unserem YouTube-Kanal Sunekos. Und mein Name ist Astrid Tomczak. Ich freue mich, dass Sie wieder reinschaut. Ich habe heute einen Gast bei mir, Dr. Epps aus London. Hi, nice to meet you. Yeah, nice to see you again. Wir werden heute über die zwei Produkte für die Gesichtsanwendung sprechen, für Sunekos Performa, Sunekos 1200. Was sind die Unterschiede? Wann wende ich was an? In welcher Art und Weise? Wie injiziere ich das? In welche Hautschichten? Und hoffen, euch damit wertvolle neue Informationen zu geben. So, welcome back.
Thank you.
Very happy we are speaking today about Performa and 1200.
Okay.
So how long have you been using the products now in your clinic?
In total, probably around 3 years now, roughly speaking. Yeah, it's quite a while.
Yeah, it's quite a while. And is it the only stimulatory product that you're using? Or?
Now it is. In the past, I have used most of what's in the market. If you can think about it, I've probably tried it at some point.
Yeah.
And when I was using all of them, the results weren't that different between them all. Certainly in terms of the official manufacturer's advice on which proteins are produced, it was almost identical. Then one day, for reasons which are too deep to go into today, but I came across Sunekos. And then I realized, well, actually, there's a claim here to produce all of these proteins, whereas everyone else is really just doing one or two things. So then I decided to try that. I'll be honest, I got no result when I first started. Many times I got no result. And then I realized because I wasn't injecting it correctly.
Okay.
To get the best out of the product, you have to inject it in a way that's very different to other products. Once I tried that, then I saw just phenomenal results. And I have never used anything else ever since. So I love the product. I was a customer first. And when I was a customer, I started shouting about how good it was and how much I love it. And that's when I started to teach it to other people as well. That's how I ended up here.
Yeah, this is how we met.
Yes,
actually.
It is, yeah.
So we have those two products. We have more in the range, and we will talk about that in another video. But Performa, I would say, is the working horse.
Yeah, Performa is the main character. 1200 is the supporting actor. But they both win an Oscar. And the way we should look at them is, Performa is carrying out the changes that we're actually after. However, it's vulnerable in the sense that if it's working in an environment that is not conducive, that is not good for protein synthesis, it's very difficult for it to do its job. So the 1200 is almost like a cleaner that cleans the office so that everyone comes to work and they can do a good job.
Okay.
And that's why we combined them in the first session. The 1200 is much more of an anti-inflammatory agent. It's a very antioxidant agent as well. And when that is in place, the office workers, the fibroblasts, they are in an environment which is not irritating to them. It's not inflaming them. It's an anti-inflammatory. They are not being attacked by free radicals. And so their ability to just focus on doing their job is much better.
Okay, I see. So if you look at the 1200, I mean, it sounds fantastic, and I can only confirm it from my own experience. But what is in the 1200 that makes it work like that?
Sure. It's the specific weight of hyaluronic acid. Because the amino acids in 1200 and Performa, they are the same. There's actually no difference there. It's what they're combined with. So the amino acids are the same, but one has this weight of hyaluronic acid and the other has that weight of hyaluronic acid.
Okay.
So the difference in hyaluronic acid is what accounts for that. Because if you look in the body, if you look in a joint such as the elbow or the knee, you will find hyaluronic acid, but you'll find it at this molecular weight, because that weight is for that job. If you look in the skin, you'll find maybe this weight, because this weight is for this job. And so when we understand that weight is key in determining the job, then we understand why there's different weights in the two different products. And it's not a case of, is this better or is that better? Should I ask my doctor for this one or should I ask for that one? You just ask for Sunekos. Because you need both. And when we have those different weights, this weight in the Sunekos 1200, that is specifically the reason it can be an anti-inflammatory and an antioxidant. And the specific receptors that it interacts with when it does that interaction, then you see those effects.
Okay, so there's a question that's coming quite often because when you look at the injection points of 1200, you see that you focus on the mid phase, the lower phase, and the lateral parts.
Yeah.
So what is the reason for that?
So good question. With the 1200, you ideally don't really want the 1200 and the 200 or the Performa in the same place, because hyaluronic acid interacts with there are many receptors, ICAM1, Siglex, etc. The receptors we're interested in for these products are slightly different. But what we don't want is, if you have a receptor here, you don't want two different hyaluronic acids trying to compete, because only one will do the job. The other one cannot then interact and is just sitting there doing nothing. And it's a bit like, I don't know if you have this in Germany, but in England, as children, there's a game called musical chairs. You walk around the table, and then the music stops.
You have to find a seat.
Exactly, and there's always one less seat.
Yeah.
Hyaluronic acid is playing, I don't know what you call that in German.
Ich muss überlegen.
Musical chairs is what it is in English anyway.
Die Reise nach Jerusalem, I think.
Possibly. It sounded good to me. But when we have hyaluronic acid in the skin, hyaluronic acid is playing musical chairs. When the music stops, it must interact with a receptor. And so we want to control that interaction with the receptor. If we separate the two weights into two different products, we can control which interaction is happening in which location on the face. If those two weights are in the same syringe, you have no control. And there is a product on the market with that. And what's interesting is when you compare those two products, that one with Sunekos, Sunekos has been patented and therefore proven to make far more protein and cell output as a result of separating those and adding the amino acids as well. We can concentrate around here and maybe a bit extra on the side, because that is all we need to achieve the effect that we have. When we combine the two products together in the first session, what happens is we achieve this kind of a repair type effect, where, again, I'll stick with the office analogy, where the cleaners are coming in the morning, lots of dirt is around the office, dirty carpet, dirty walls, broken things. And when we send in both hyaluronic acids, these cleaners are cleaning up the entire place and repairing everything, so that when the Performa comes, everyone can get to work very, very easily. So there's a lot of nuance between them, but once you've done them together in the first session, the reason you don't need it afterwards, it's like if I have a cup, the cup is broken, I fix the cup, I don't need to keep on fixing because it's fixed. And so when you put them together and things are repaired in the face, there's nothing to repair anymore.
I agree, but what if you have a skin that has a very severe damage?
Good question. So these are the situations where you need to use your brain, which I don't think a lot of people do in the industry when it comes to the marketing. And we have to see that there's a reason we use things like 1200 to treat things like oxidative damage and inflammatory cascades, shall we say. And if we find that a patient has returned to us after a few months, maybe they have been visiting a sunny country, they've been in Australia, a lot of sun damage. In my clinic, I would then retreat with 1200 to treat that oxidative damage. However, the standard treatment, which is on label, that is given as just the first session, simply because the standard method that's taught cannot account for every single type of situation.
Absolutely.
That's all. And so part of the training, if people are going to be trained in the product, is to understand the scientific backing of these different aspects of the treatment, so that they don't have to follow the protocol. So they can think in the moment for each patient and say,
what is the best?
Exactly. So even though the protocol is this, you've been living in Australia for 6 months, I'm going to change that protocol because you need something different for today. And that's the best way to do it.
Okay. When we come to the application of the 1200 and the Performa, there are important differences. So how do you inject 1200?
Sure. So there is a slight difference in depth. That's the main difference. So 1200, you can actually use a cannula. You simply place the cannula as superficial as you can. You won't be in the skin, of course, just underneath. That's fine. The Performa does need to be in the skin though. That actually needs to be in the dermis. Around mid-dermis is fine. And this sounds easy.
Yeah. It's not. I can.
No, I promise you, I have taught this to over 10,000 doctors now globally.
Wow.
I've never seen a single one inject it perfectly.
Okay.
Not one. So it's not easy, and especially around the eyes. There is so many reasons you could be injecting wrong around the eyes, and I urge you to just have one session where you at least see someone like myself doing it, and if you have difficulty after, as everyone has so far at least, then you realize why it takes maybe 2 or 3 patients to learn the technique properly. Certainly when I first used Sunekos, I'll be very honest, I saw nothing. But that was because of me. Once I perfected the technique, then I saw very, very good results, and I've never used anything since. So the technique, and I'll be honest, the problem with Sunekos is it's very technique sensitive. Excuse me. We'll leave that in, just so you know it's live. We'll tell Christoph, who's editing this, to leave that in. What I was saying was the problem with Sunekos is it's very easy to inject it wrong. And you have to, for the first few patients, you have to go slow. Once you do that and you really pay attention to, am I injecting this correctly in the right layer? Is it looking like it's been placed in the correct layer? Then you can go quicker and quicker and quicker, and it's no problem. But those first few patients, there is a learning curve. It's not a simple inject, done. You have to really think your way through it and make sure it matches what you had on the training session as well. But it's a small price to pay, and if you're willing to do that, you will see results that are unmatched, in my opinion.
Interesting, because in the beginning I didn't think that it is really so technique sensitive.
Yeah, and neither did I.
Yeah.
Neither did I. But I think it's not necessarily that it's technique sensitive. I think it's just injected so differently to other things. No one's really had experience in injecting that way before, and that's all it is. If the way this is injected was the same for every product, I didn't think anyone would have a problem. They would just do that straight away. But because it is so different, especially around the eyes, which I've said before, no one's experienced in that.
Yeah.
And so it takes a few patients to get it correct.
Ich spreche mal kurz auf Deutsch. Wir haben genau für diesen Zweck eine ganz tolle Videobibliothek angelegt, wo Dr. Epps sehr, sehr viele Indikationen mit den Performa und den 1200 Produkt gezeigt hat. Und das haben wir aufgenommen. Und wenn ihr ein Training bei uns bucht, dann bekommt ihr auch Zugang zu dieser Bibliothek und könnt euch diese Filme in aller Ruhe nochmal anschauen. Das ist auch im Nachgang ganz gut, weil eben diese kleine Lernkurve, die gibt's. So when it comes to the protocol, so we have now talked about what the products are, what they are doing, how they are going to be injected. So there's a protocol, a standard protocol, as you mentioned already shortly. So we have the 1200 first and the Performa in the same session. And how do I continue then?
So again, this standard protocol is what is taught by default. There are situations where you may modify it once you are experienced. So my answer today is not going to be based on that situation. I'll answer based on the standard protocol.
Yeah, please.
So in standard, once you've done the first session with both products, 1200 and Performa, then you really just need the Performa on its own.
Okay.
And again, the reason for that is if I have repaired my phone, I don't need to keep on repairing. It's repaired and I can use it. So the combination does that repair. Then I can use the skin and use just the Performa afterwards going forward. And that's where we see the production of all these proteins that are in the pattern as well.
Yeah. And your experience is that 2 additional sessions are enough in most cases, or do you add on a fourth one?
So I think it's highly variable. A lot of time it's actually more because of the patient. If someone is coming and needs a lot more work because they are aged so much more, typically they may go 3 or 4 sessions as an average. If someone was just after one little maintenance session, it might be just 1. The average is probably about 3. However, I have 7 patients now in London where I give them Sunekos every 2 weeks.
Wow.
For life. The only time we don't is if they are away in a different country, or maybe I'm in a different country like today, and then we'll carry on when I get back. And that's it. And the reason I can do that is because there is no harm. Nothing is left in the skin like filler. Nothing is an ingredient that was not naturally found in the skin. Nothing is a cosmetic grade ingredient. Everything is pharmaceutical grade. There has never been a reported allergic reaction. Everything is working physiologically rather than through inflammation. So there is no such thing as too much as far as biology is concerned. There is such a thing as too much in terms of cost for the patient,
of course,
number of visits to the clinic, etc. But these are real world things.
Yeah.
As far as the science is concerned, there's no such thing as too much. That's all. You can do things too frequently. The sweet spot is probably about 2 weeks. You can go a little bit sooner if you want. I don't think it's worth going more than 3 weeks. If you are going to do 3 weeks, you're probably best off doing your 1200 and starting again, in my view.
Okay, okay. And there's for sure the question, because we all have different products in the clinic for different reasons, for different purposes. We have threads, we have the energy-based devices, we have the fillers, we have the botulinum toxin. So how does Sunekos fit in?
Great question. So I think in terms of treatment planning, you have to understand Sunekos is a physiological product. It's not an inflammatory stimulus. There are times when it's perfectly reasonable to consider an inflammatory stimulus, and once you use that as a stimulus, you can then bring in Sunekos to direct that growth, and that's okay. There's actually nothing wrong with that, as long as you know what you're doing and you understand the kind of inflammation, the extent that you are using. And so there is a place for using Sunekos alongside another injectable if one wishes, and they understand it very well. However, typically, Sunekos is able to improve the results of other treatments. So just pick a random example, let's say a laser.
Yeah.
If you do some Sunekos in a specific way, which is probably a video for another day, but if you use that before laser in a specific way, then the skin's inflammation level is probably a lot lower prior to the laser. And also, if the quality is improved slightly, maybe the thickness has increased, you've now got a more of a cushion for the laser. Because its skin is very thin, it's very easy for the laser to go too deep. If you are able to improve the thickness, then it's harder to do that. If you're able to bring that inflammation level down, there's less risk and scarring and burning and things like that afterwards. And if you do Sunekos after the laser as well, again, you should be able to improve the healing period, and you should get a better result afterwards as well.
Okay.
As a rough guide. There are more specifics, and you can talk specifically about every single treatment. But
it was more a general question.
If
because
people come to training, we can look at things like that, no problem.
Well, you have this amatorium, and you need to think of how to plan a treatment for a patient, because it's, at least in my experience, correct me if I'm wrong, it is almost ever several things that you need to come to the final
Typically, in my
result.
clinic, every single patient, I think, is combination therapy.
Yeah.
Every single patient.
That is where we go.
Yeah.
Yeah. So, another question that is coming very often. When you treat the neck or the décolletage, you don't use the 1200. You start with Performa, and you do only Performa 3-4 sessions, depending on the skin condition. So what is the reason for that? Why is there no 1200?
So that is simply the standard protocol. This comes into the idea that we have a standard protocol because everyone needs a standard protocol to sell a product. But part of training is understanding it and being able to modify that protocol. And so the standard protocol is, yes, we can just use the Performa, because typically we'll probably treat other areas with 1200 as well.
Yeah.
In my clinic, the way I work is, if they want just the neck, just as an example, I will use 1200. I will try and use 1200 around the jawline, around the base of the neck, and the Performa in between, a bit like a sandwich.
Ah, okay.
And in the décolletage as well, if I'm treating, let's say, just this area, similar technique, I will try and use 1200 maybe a little bit above the sides, at the bottom, like a frame of a painting. And then put the Performa in the middle, and I'm combining them together. So it's perfectly okay to do that. I would encourage people to do that if they think it's appropriate, and I would encourage people to understand the standard protocol is not one size fits all.
No.
Yeah.
It's never like that in medicine.
Yeah.
Yeah, I agree. And last point for today, the hands. There is also a protocol for the hands.
There is.
the cushion technique. Can
Yes.
you explain a little bit more about that?
Sure. So this is an area where we, again, combine 1200 and Performa. And the reason for that is typically if we were to look at myself on camera right now, my skin above my collar is exposed to if I was outside the sun, and my hands are exposed to the sun as well. So these areas are going to have more oxidative stress than areas like, say, my arms or my legs or something like that. When we understand that, which is very easy to understand, then we understand that there is a difference in the level of oxidative stress and damage in those areas. So that's why in the hands, we also use the 1200, because if they are exposed to the sun more often and more oxidative stress, then there's more reason to be using 1200 because it's an antioxidant, it's an anti-inflammatory. And so we will combine them together. Typically we will do, let's say, a few streaks of 1200 and then Performa injected around those streaks or lines or threads, but not in the same exact position as well. It's a very simple technique. Each hand, once you are experienced, is probably going to be 2 minutes of work, and that's really all you need to worry about.
Yeah. Thank you very much.
Thank you. Vielen Dank.
Yeah, over time we will improve the German.
Okay. Yes.
Next one is in German.
Good.
So, thank you very much for being
Thank you for
our
having
guest
me.
again.
Yeah.
Danke für euer Interesse. Ich hoffe, wir konnten die wichtigsten Fragen rund um 1200 und Performa heute gut erklären. Falls nicht, schreibt uns gerne in den Kommentaren und wir kümmern uns drum und geben euch schnellstmöglich Antworten und freuen uns natürlich, wenn ihr das nächste Mal wieder mit dabei seid. Vielen Dank.